Diabetes is something which has become so common over the past few decades, and this is said to be a cause of worry as most people don't understand how to prevent and manage it. This has led to some myths gaining more than their fair share of popularity. So, wouldn't it be a good idea to get to know a little more so as to separate the myths from the facts? Wait and watch. One of the most common myths when it comes to diabetes is the belief that a person is going to have his or her life adversely affected if he or she is overweight. Where it is true that being overweight happens to be one of the risk factors related to diabetes, it is important to keep in mind the fact that there are other risk factors which are responsible. Some of these factors are age and family history as well as the ethnicity of the person. Taking this into account, it should not come as too much of a surprise to know that there are quite a few people who are not overweight but are still fighting diabetes. Package tricks. Considering the rise in the number of people who are suffering from diabetes, this has led to a food being marketed specifically for their consumption. However, in reality, whatever represents a healthy diet is sufficient for a person who is diabetic. So, a diet which does not have a high amount of saturated fats and trans fats and does not go overboard with starch and sugar but features a fair amount of lean protein works well. All the fancy diabetic food which a person buys is only likely to drive a great hole in the wallet and not to have any additional health benefits. Therefore, the extra spending is nowhere close to being worthwhile and should be avoided. Fruit sponge. Many people are of the opinion that it is the processed and sugary food items which cause diabetes, and this is true to a significant extent. However, some people are of the view that since fruit is natural, diabetes can eat as much of it as they like. This is where the thinking gets dangerous. Some fruits are rich in carbohydrates and so it should be consumed in a reasonable quantity as part of the daily meal plan. After all, too much of any good thing is bad. We take a pledge, we will treat you well.